Manitoba has declared a public health emergency over its rising number of HIV cases.
Manitoba continues to experience some of the highest rates of HIV in Canada. In 2024, we reported a rate of 19.5 cases per 100,000, which was roughly 3.5 times that of Canada's rate of 5.5.
The province's Chief Public Health Officer, Brent Roussin, says a level of urgency is needed to address the issue. Katherine Dornian joins us now from Winnipeg with more on this story. Katherine, we appreciate this. So HIV rates in the province of Manitoba, we understand, have been steadily increasing over many years now. What's driving this?
Well, Dr. Roussin told us this morning that it's drug injections which are linked to most of the cases. In fact, he said up to 70% of these new diagnoses are being linked to drug injections. And another large proportion of cases are being linked to unprotected heterosexual sex. And if we look at the numbers, they are concerning, especially since HIV rates have been declining globally for many, many years. But in 2021, we had over 140 new cases. Last year, we had more than 300, and we're probably on track to hit that again this year with 120 cases reported just in the first quarter of 2026 alone.
Startling numbers. And the Chief Medical Officer of Health also raised concerns regarding the demographics, Indigenous groups and women disproportionately affected. What more have we learned on that?
Well, as we know in Manitoba, many of Indigenous folks live in rural and remote areas where there's simply less access to health care and to things like testing. And women, as he said, over 50% of the new cases. And that may be linked to the fact that preventative measures are underutilized by that demographic. And of course, we know that there's the comorbid factors of homelessness, poverty. Many First Nations people in Manitoba likely to deal with barriers to housing. All of those kind of come together into less access to healthcare and testing, which is a big part of this increase, according to the province.
Okay, so while other parts of the world and in this country, the numbers are trending downwards, there's a public health emergency in Manitoba. Dr. Roussin also said that a level of urgency is needed. So what changes now that this the emergency has been declared?
Well, part of it is a dedicated steering committee that the province is going to set up to deal with this. And some of the measures they mentioned include just increased awareness. They're going to be working with some community groups to get the measure out on the street to the people who need to hear it, to get that message to them. Also, more testing. They want to do more blood testing and also different types of testing. Dr. Roussin mentioned a possibility of self-testing. What that looks like right now is unclear, but I assume we'll be hearing more about it as this emergency progresses. And just generally, more access to healthcare. They're going to be working with some of these Indigenous groups that work with people on the streets and people in their home communities, and people who just groups that have access to the folks who are underrepresented and underutilizing the healthcare system to get the testing and treatment they need. So that is the plan as of now. We're going to hear more details, I'm sure, as things go along.
An important update. We appreciate this, Katherine. Thank you. That is Katherine Dornian joining us from Winnipeg.